Hello everyone. So now in this video we'll be discussing on patent ductus arteriosus. Okay. So this pathology is actually congenital pathology. It is present by birth. So what it is? So it is a condition, patent ductus arteriosus, in which blood flows between the aorta and the pulmonary artery after baby is born. So normally before the birth or before the baby is born, this duct is open for the circulation, but as soon as the baby is delivered, within first few days, this connection closes between the aorta and pulmonary artery in the normal patients. Now if this does not closes after the baby is born, then that condition is called as patent ductus arteriosus. Okay, so you can see in this diagram actually, so you can see this is actually your aorta, arc of aorta, and this is your pulmonary artery. Okay, so in this connection you can see here, so this is the connection which remains open after the birth, so that is called as defect. Okay, so this also you can see, so blood flow is going into the left pulmonary artery here, and this is the way. Okay, so this is aorta and this is the patent ductus arteriosus. Now disease prevalence in which groups? So most common congenital heart defect it is, most commonly it occurs, and this condition is about 2/3 of the children with birth weight of less than 1000 gram or 1 kg are prone to occur with this type of pathology. Okay, and premature babies are at higher risk, and the babies of range from 1000 to 1500 gram are less common, and 1500 to 75 gram are 15% at risk. Now what are the structure of heart and blood circulation in this case? So in full term newborns, ductus arteriosus closes during the first day of life, as I told you, and normally. So if this non-closure occurred due to increase in level of oxygen in the blood, due to oxygenated blood in the lungs actually, so because of that there is buildup of fluid in the lungs, because this blood which is again going back into the lungs through this pulmonary artery, because this connection has remained open, so because of that accumulation of blood, and this closure does not occur due to the concentration of decrease in concentration of prostaglandins. Okay, PG. Now this PDA, patent ductus arteriosus overgrowth, depends on the size also. One means the diameter of that opening between the connection, so that can be of small size, middle and large. So in small size there can be overloading of left ventricle with normal pressure in lungs. So in this case lungs are normal actually due to the small opening. If this opening is in the range of small to middle, then dominant overload is on left ventricle. If middle, again, then dominant load on right ventricle. If large, then severe overload on heart, and Eisenmenger syndrome occurs. Okay, so this is spatial syndrome which can occur in the large size of patent ductus arteriosus as a complication. Okay, so as we can discuss some point about Eisenmenger syndrome. So it is a long-term complication of congenital heart disease. So it's not specific that it will occur in patent, but other pathologies it can also occur. So but in patent ductus arteriosus we just see this syndrome as a complication. Now in this patient comes with bluish and grayish skin, that is called as cyanosis. Drumstick symptoms means fingers will become rounded. So this fingers you can see the shapes can round. Fatigue and shortness of breath, and shortness of breath can be at rest. Chest pain, patient complains dizziness, hemoptysis, bleeding, okay, through vomiting, and headache. So these are the symptoms of Eisenmenger syndrome. So we can see one image here. So in this image you can see there is a healthy heart, but in Eisenmenger syndrome there is a ventricular septal defect between the ventricles. The closure is not done, so the blood mixes from left to right, and there is dilated pulmonary artery. So there is dilation of pulmonary artery due to thickening of valves, and there is ventricle hypertrophy, so increase in size of right ventricles. So these three signs we actually see in the heart. So that is called as Eisenmenger syndrome. Clear? Now we have to see the symptoms common to all types of pathology in patent, so in congenital diseases. Systolic murmur we will see at the second intercostal space between left scapula. Heart rate is decrease in blood pressure. Now how does the pathological process develop in this disease? Now we can see the pathology, how it develops. So it develops in the decrease in the pulmonary vascular resistance after birth, causes an increase in blood flow to the lungs, Okay, so their resistance to the pulmonary blood circulation, that is pulmonary blood flow, decreases, and because of that, as I told you, there will be increase in the amount of oxygenated blood in the lungs. So due to that, there will increase in pressure in the lungs. So that line is liquid causes an increase in blood flow to lungs, and this causes pulmonary hypertension. So pulmonary hypertension occurs due to increase in pressure and leads to alveolar and interstitial pulmonary edema. So due to accumulation of blood, that is fluid, it can lead to edema. Okay, and reduces the elasticity of the lungs and tissues. So now the lungs cannot expand fully due to accumulation of fluid. Now organ hypoperfusion occurs with a risk of new pathology, especially in premature infants weighing less than 1500 gram. So there is decrease in the perfusion pressure to the organs. Now, can this patent ductus arteriosus occurs in adults? Yes, it can occur in adults. Very rare, but disease is only congenital, so it occurs only from birth. Starts from birth, but cannot arise after it. Okay, so it is not that after birth baby is normal and later on stage it can develop. It actually starts from the birth. Okay, so PDA in adult size increases from small to medium. So during the birth, if size is very small, so in later on stage, in adult stage, it can reach medium or large. So that change we see in adults actually commonly, but it is very rare that it can occur in adult. Okay, so symptoms appear like bacterial endocarditis. It can lead cardiomyopathy, pulmonary hypertension, and death later stage. Now, what are diagnosis we will do? We can do X-ray, we can do ECG, EKG. Okay, CT we can do, MRI we can do, cardiac catheterization. We can control the blood pressure. We can regularly monitor the oxygen saturation rate of the patient. Now, what are the diagnosis criteria? So mostly diagnosis criteria is done by physical examination and echocardiography, and later on we do MRI and CT scan of the heart. Okay. Now, what are the differential diagnosis we will rule out? We will rule out aortopulmonary window, Garland syndrome, pulmonary fistula any, or any rupture of valsalva sinus aneurysm. So any rupture of aneurysm. Now, what are the management or treatment we do? We give oxygen therapy due to low oxygen level, connecting the child to ventilator firstly. Secondly, now we will correct anemia due to loss of blood in the organs. We will use diuretics to decrease the pulmonary edema. Okay, so we'll decrease the pulmonary edema by giving diuretics. This is a medication. And indomethacin we will do to increase the level of prostaglandins. Okay, so indomethacin is given as a drug, but indomethacin is not given with patient with renal failure. It's contraindicated, and the patient who have decreased platelet count. So this is the patent ductus arteriosus in simple language. Okay, thank you.